Hi guys, Dr. Loretta here. So by the end of this video, you're going to know what not to say to your therapist so that you're able to build and foster that therapeutic relationship, maximize your time in therapy, and get the best out of your therapy sessions. Going to therapy can be nerve-wracking, most especially for someone who is in therapy for the first time. Therapy is a safe space, and knowing this can lead a patient to saying things that are inappropriate to their therapist or saying things that could lead to the therapist taking certain actions that could potentially break that therapeutic trust. This is not intended to make you overly cautious at your therapy appointments, overthinking your words before saying them, withholding information, or give up on therapy. But this is so that you're able to make an informed decision and be able to get the best experience out of your therapy sessions. Let's take it to the things you should not say to your therapist and why. Some therapists might disagree with some of these points. However, the points that I'll be sharing with you today are points that will mostly be agreed upon by most therapists. Point 1. Do not lie to them. Therapists are not mind readers. And if you do not provide us information that are beneficial to your treatment, then we would never know. We do not know what we do not know. So be honest with your therapist. Don't lie to them. Don't tell them partial truth. It does not benefit you withholding information from your therapist, like telling them that you're doing better when you are not, or telling them that you're doing worse when you're actually doing better, or even saying yes to everything that your therapist says, even when you know that this is something you do not want. An instructor I had in college once said something in class that has stuck with me over the years. And he said, therapy has almost nothing to do with your therapist and has everything to do with the patient. If you do not like something that your therapist is doing, speak up. Let them know. If you don't like the treatment modality that's being used in sessions, speak up. You're the customer here. And if you speak up and your therapist is not receptive of it, then that's your cue to leave that therapist and find another therapist. You are part of the treatment team when it comes to your care. I know sometimes you say yes so that your therapist likes you. And I know that some people are people pleasers and wants to be liked by everybody. But note this, your therapist is supposed to be a neutral body, and your therapy sessions are supposed to be a safe space for you, void of judgment. Your therapist is there to help you even when you're wrong. Although there's a caveat to even when you're wrong, right? There's a caveat to that. But not be the one to throw stones at you. If you lie to your therapist and tell them that you're doing good when you're not, this could lead to premature termination of care when services are still needed. When you exaggerate symptoms, which sometimes people do for good reasons, right? Like they want to continue working with that therapist. However, what ends up happening is that that therapist might end up transferring your care to another therapist or transferring you to a higher level of care. When you exaggerate your symptoms, which sometimes people do for good reasons, right? Reasons like you want to continue working with that therapist. What ends up happening is that that therapist might end up transferring your care to another therapist or transferring you to a higher level of care, which is the right action to take at that point in time because, again, like I said, therapy has everything to do with the patient and almost nothing to do with the therapist. So the mindset behind that could be, maybe I, as a therapist, I'm not offering this person what they really need. How about, or there's a barrier to why they're not getting what they need from me. How about I transfer them to another provider who could give them what they need or does not have that barrier that could be the hindrance to why they're not getting what they need, or a higher level of care, because the therapist's mindset is that this level of care probably is not appropriate for you. You probably need more than what this level of care is offering you. So this is a disadvantage of exaggerating your symptoms, even though the reasoning behind it might be logical or might be a good reason in your own definition of good, right? Your therapist might feel at this point that an inpatient hospitalization, a partial hospitalization, or an intensive outpatient may be more appropriate for you, with the mindset of the fact that they've been seeing you for this long and your symptoms are not getting better, and they feel that you might be needing more frequent appointments than they're able to offer you in this level of care. Which brings me to my next point. Do not say what you do not mean. You must understand that your therapist is a mandatory reporter and is partly responsible for your safety while you are in their care. When a risk of harm is mentioned to your therapist, even if you don't mean it, we do not know. Like I said earlier, we are not mind readers. So do not say you're suicidal if you are not. Because like I said, your therapist is partly responsible for your safety while you are in their care. So when you say these things and we not being mind readers and knowing that you don't really mean it, we're going to take the actions that are necessary given the level of risk posed. If a harm to self is mentioned, your therapist might feel the need to complete a safety plan with you and in some instances, employ the help of others to help keep you safe. According to the World Health Organization, 700,000 people die by suicide every year, and suicide accounts for 1.3% of death worldwide, making it the 17th leading cause of death. I say this to create an awareness so that you understand why when you make these statements, when you say these things, some actions need to be taken. I visit a lot of mental health pages and sites, and one of the narrative that is driven out there is the fact that once you tell your therapist that you're suicidal, they lock you up. First of all, that's not how it works. No therapist has the right to lock you up in a psych ward. There are rules that apply to inpatient hospitalization, be it voluntary or involuntary, and these rules vary based on location. I have seen two rules based on the areas, states that I have practiced in. There might be other rules out there that I don't know of, but I will be talking specifically on the two that I confidently know about. One is where a hospital assesses an individual and places them on a medical hold because they are deemed to be at an imminent risk, which means they have a suicide ideation with plan and intent with no protective factors or minimal protective factors and no ability to maintain a safety plan. The other practice which I have been more actively involved in is where a hospital assesses an individual and deems them to be at risk. At that point, the hospital calls the state, they have a state agency who then sends a therapist out who is a neutral body, right? Because the therapist works for the state, not for the hospital. And that therapist comes out and assesses that individual and deems that individual to be at imminent risk of harm to self or others with no protective factor, no ability to maintain a safety plan. At that point in time, that individual is placed on a hold. This initial hold lasts for only 72 hours, but within that 72 hours, the case is presented to a judge, which at that point in time, if the judge approves of it, then that individual is placed on a 14-day hold. After the 14 days, if that individual is still not doing better, then they present the case again to the judge, who then approves for this individual to be placed on a 21-day hold. In this system, all the bodies or agency or organizations involved are neutral parties, which decreases the likelihood of a bias or a retaliation against the patient. Secondly, the fact that a person is suicidal does not mean that they need to be in a higher level of care. When I say higher level of care, what I mean is inpatient hospitalization for acute stabilization, or long-term mental health treatment. Acute stabilization is more for imminent risk where someone is acutely suicidal, homicidal, psychotic, or manic. It is usually a short stay, averaging anywhere from 3 to 7 days with therapy and or medication management, constant monitoring, and eyes on every 15 minutes until they are stable. When they get stable, they get discharged to the next level of care, which can look different depending on the individual. Stabilization is usually a little longer. It could go up to like 28 days. And this is more for mental health concerns that are not imminent risk. In this situation, they get more liberty than acute stabilization. They get to go out of the facility, again, depending on facility rules. This is mostly used for mental health concerns that will take a longer time to stabilize. For example, things like trauma. They have trauma treatment facilities that specializes in in-depth trauma treatment that takes a while. And the third is a much more longer term mental health care for individuals who cannot function in regular environment, who would need constant monitoring by a professional. This is more like disabling mental health conditions. Other things I mean when I say higher level of care are like the partial hospitalization. This is usually a 5-day treatment programming that lasts about 2 weeks, 3 weeks, 4 weeks, again, depending on how the hospital set up their treatment programming. So it's usually 5 days a week for 6 hours. It includes medication management and therapy, where the individual goes to the hospital every day, receive treatment, and go home. They do not sleep at the hospital like inpatient hospitalization. And the last one is intensive outpatient. I've seen hospitals set it up in different ways. I've seen hospitals do 5 days a week. I've seen hospitals do 3 days a week. But the most typical one I've seen is where you go to the hospital 3 days a week for about 4 hours. It usually entails therapy. Some facilities also offer medication management in an IOP setting. But same like PHP, you go to the hospital, you receive your treatment programming for 4 hours, and you go home. With that being said, people can be suicidal with plan and not need to go to higher level of care. Again, it depends on the level of risk posed and protective factors surrounding that individual. Please do not misunderstand this to mean don't tell your therapist if you're having this thought. Remember, the emphasis is don't say it if that's not what you're thinking or if that's not what you mean. If you're having this thought, please communicate it with your therapist because they're able to get you help. Again, the longer you sit on this thought and not tell them, the more likelihood it is for these thoughts to become worse. So the earlier you have this thought and communicate them, the earlier and the more likelihood of this being able to be maintained at the lowest level, get you the help that you need as soon as you need it. Which takes me to my next point. Do not report illegal activities to your therapist. Majority of the things discussed in therapy are confidential. HIPAA protects your record from being disclosed. However, there are some things that HIPAA does not protect you from. Your therapist is a mandatory reporter, and being a mandatory reporter, there are some things talked about in therapy that they are required to report, which is why when you get to your first therapy session, they typically give you a consent form where you read your limits of confidentiality and sign stating that I understand that if these things are said, my therapist is required to report them to the appropriate agencies. I know that when people build trust with their therapist, they feel the need to tell the therapist everything, their deepest secrets, which we appreciate as therapists, you trusting us with your mental health and with your deepest secrets. However, some things that you tell your therapist has to be reported. Like if there's any incidents of domestic violence, child abuse, elder abuse, your therapist is required by law to report these things to the appropriate agencies. Your therapist is required by law to make notification to law enforcement agencies or to child protective services, depending on what the case is. If you report a harm to others, they are required by law to take some certain actions. Some notifications must be made by the therapist. Again, depending on the risk level posed, hospitalization may be required. Think about how many times you've seen active shooter incidents, and by the time investigations are going on, come to find out that that individual had made threats in the past that was never taken seriously. Hence why the terror soft law came into being. The mandatory part of notifications needing to be made when there's a harm to others. And be honest with yourself, would you not like to be warned if somebody's actually plotting to harm you? Before we continue, if you're yet to, please take this moment to like, subscribe, and share with your friends and your loved ones so they can join us on this journey to mental wellness. And if you stick with me to the end, I will be sharing 6 more things that you should not say to your therapist. The last 2 tips are by far the most important, and you do not want to miss them. Point 4, do not make sexual comments to your therapist. There are ethical codes that binds your therapist and bars them from being friends with you or engaging in any kind of sexual relationship with you while you are under their care, and even for a duration of time after you are done with treatment with that therapist. According to the American Psychological Association, it is considered immoral and a violation of multiple ethical standards for your therapist to engage in any kind of sexual relationships with their patient or be friends with their patient. The National Association of Social Work, on the other hand, prohibits therapists from having or engaging in any kind of sexual relationship with current or even past patients, their relatives, or even close associates with those patients. So now you see the severity of this. Your therapist cannot engage in any form of sexual activity or relationship with their patient, or else they get to face very severe consequences. Your therapist also has feelings. So making sexually explicit conversations, making sexual comments, sexual advances, asking them out can be uncomfortable for them and offensive. And they have rights too. That therapist can end up terminating care with you on those grounds, which they actually absolutely do have the right to. Your therapist cannot hang out with you, go to the bar with you to grab a drink, go to the gym with you, go hiking with you, or be seen with you outside of a therapeutic environment, outside of the both of you just bumping into each other and just exchanging pleasantries and moving it along. If you make any of such requests to your therapist and they turn you down, please, it is not because they hate you. It's not because they are being difficult or closed off. It is because they do not want to and they cannot. Boundaries are necessary for any relationship, let alone a therapeutic one at that. This is almost under the same concept of doctors cannot treat their family members because emotions get involved, biases come in, leading to a conflict of interest. And it's not as easy as, oh, I would just terminate care with them so that now I can date them or engage in any kind of sexual activities with them. Depending on the code of conduct or ethical code that binds them, they probably might never be able to ever have anything to do with you because you were once their patient. And even those code of ethics that even permits them to do something afterwards, they still have to wait for a period of time post that termination of care before they can even have anything to do with you. Leading on to my next point. Do not threaten your therapist. Please do not threaten your therapist. Depending on the environment and the type of threat made, your therapist can have you escorted out of the building by security. They can terminate care with you, get law enforcement involved, get restraining order against you, and other judicial actions can come into play, again, depending on the type of threat made or what the case is at that point in time. Just as you are entitled to safety, so is your therapist. According to the American Psychological Association, a therapist can terminate care with any patient who threatens or endangers them or anyone associated to them. I understand that sometimes you might be angry with your therapist. You might have found them to be rude or disrespectful. However, under no circumstance or situation should you threaten your therapist. There are other avenues to tackle this type of concerns. There is usually always a patient advocate in any hospital or clinic that you can always take this type of concerns to. Talk to the patient advocate. Talk to their supervisors if they have supervisors, or any person in a management type role that you can report this type of situation is. But please do not take matters into your hands, because then again, two wrongs don't make no right. On to my next point. Do not ask your therapist for money. This is a therapeutic relationship, and you cannot be borrowing money from your therapist or your therapist borrowing money from you, or getting into any kind of business partnership or any partnership of any sort with your therapist that has the potential to fracture this relationship, this therapeutic relationship, or induce any form of bias into that relationship. There cannot be any type of dual relationship between you and your therapist, because this can impair your therapist's judgment and introduce a conflict of interest. You as the patient do not even want this, as this can affect your care, shortchanging the type of care that you receive from that therapist. Do not make your therapy appointments awkward. Leading me to my point 7. Do not make racial, religious, or any type of stereotypical jokes in session. It can be offensive to your therapist and make your therapist uncomfortable. It can make your sessions awkward, create this weird vibe and tension in your therapy sessions. Your therapist is human, with full functioning emotions, and making any negative remarks against any specific groups of people could be offensive to them. They might not look like the group that you're making fun of or making negative remarks against. However, they could be, or they could have family, friends, loved ones that fit into that category. Besides, what has any of that got to do with why you are in therapy or your therapy sessions? Point 8. Do not tell them every single details of every activity every single time you have a therapy appointment, to avoid the actual concern that brings you to therapy. Tell vital information that relates to the reason why you are in therapy. Talking about a mice and a cat that you saw on the street and every single details about the incident could hamper your treatment. You have to understand that you have only 60 minutes per session. And if you spend all that time or almost half that time talking about unnecessary events or incidents that do not pertain to your mental health or your mental wellness, then it eats up into the time that you would actually spend in actual treatment or actual things that could benefit you or get value for that session. And then you missed out on treatment for that session. Your therapist is a listening ear, and your therapy session could be a time for you to vent. And you can actually spend that whole 60 minutes venting if it ends up making you feel better. Your therapist is a listening ear, and you can spend that entire 60 minutes venting to your therapist if that helps you, if you feel better afterwards. However, the point is spending that time gossiping, talking about other people that have nothing to do with anything, or talking about other frivolities. I say that to say that your therapist might not stop you when you are doing this because they do not want you to feel like you're not being listened to or heard. So they might just let you go on, or your therapists themselves might just have bad boundaries. Point 9. Do not probe your therapist for personal information. Your therapy session is about you and not about that therapist. They can only self-disclose if it is therapeutically necessary or beneficial and if they are comfortable with it. Your therapist will not and should not share information of their own personal interests that could be bothersome to you or non-beneficial to you. I get it that you're curious about the person sitting across from you. However, if you ask them for personal information and they do not want to disclose, let it go. Some people feel uncomfortable talking about themselves, so respect that. At this point, you know what not to say to your therapist. Note that your therapist has rights too and are humans too. So do not take any boundaries that they set as an act of rejection. Be open and forthcoming in therapy so that you get the best out of therapy. Talking to a professional is always an answer, most especially when done appropriately. Remember, you can never go wrong with therapy in the hands of the right therapist.